Occupational health reports contain advice. That advice sometimes is welcome and sometimes it's unwelcome, but the key thing is it is just that. It's advice. It does not have to be followed. There is no law that says you must follow the advice given to you in an occupational health report. The information that a report contains is always used as a basis for making management decisions. Now the key there is management. No occupational health clinician is ever going to say, and now you should dismiss the employee. No occupational health clinician is ever going to tell you what decision you should take arising from the information and advice that they give you. The reports that are provided, generally speaking, will always follow a similar pattern, no matter who you seek advice from. They will always have to tell you the background and summary of the situation, which is often telling you what you already know. That has to be done to show the occupational health professional has conducted a fair, impartial and objective assessment of the circumstances. They should then lead on to answering the questions that you'd raised in any referral to occupational health. It's worth mentioning, sometimes answering some questions, particularly forward-looking ones. What's the prognosis? Some of those questions can be really difficult to answer because not every clinician is given a crystal ball when they graduate from medical college. Predicting the future is sometimes an inexact science. However, some of the language patterns that are used can often be helpful in interpreting and deciphering what the clinician may mean in an occupational health report. It's very common to have language patterns like, the employee tells me that, the employee perceives that. Now that doesn't mean to say what the employee has said is factually true. It just means that's what they believe. That's what they've told the clinician. Now, if that's something that's not welcome when you read the report, that's the time to conduct an independent, impartial investigation. Follow the ACAS code. Choose whether to uphold the accusations, allegations, or not. Then you can get back to the heart of the matter, which is usually an issue regarding health or performance. Quite often, phrases like prior sight will be put into an occupational health report. That just means the employee has asked to see the report before it is sent to you. That doesn't mean they can change what's in the report though. An employee can only ask a provider to change factually incorrect information, and anything that says, in my professional opinion, or in my medical opinion, is just that. The clinician does not have to change it. It's just an opinion or advice. It is worth mentioning you can always seek clarification from any occupational health provider. If you receive a report and you don't understand what the advice means or the context of it, contact the provider. Don't dwell on it. Don't feel bad. Contact the provider and they will always be happy to explain what's driving their advice and to give you context to the information that's there.